So my name is Alice Chapman-Hatchett. I'm the director of the Centre for Healthy Empowered Communities. And some of you may know me, us, under our previous name, the Health and Europe Centre, and the European work that took us to where we've arrived at today. And what I'd like to share with you is a bit about that journey. So we were established in the late 1990s as a social enterprise company, so a not-for-profit company. We're a very small team, we always have been. And I think that makes us very agile, and also it speaks highly to our success as well. We've achieved a lot with not very many of us. And we are part funded by the Kent and Medway NHS and local government organisations, but also together with funding from individual research and development programmes that we bid for. So what is it exactly that we do? And also equally, what is it that we don't do? We collaborate, communicate and co-create. We put together health and social care projects to test interventions and provide an evidence base to improve people's health and well-being. We work with every stakeholder, no matter what their background, giving a voice to everyone, and we take a bottom-up approach, engaging everyone via active listening, amplifying ideas and good practice to benefit the wider health system. So how do we do that? We provide expert resource and skills that organisations, whatever their size, may not have. Just because somebody is an excellent nurse does not mean that they have the skills necessary to go through the bureaucratic process of filling in applications forms for research and development funding. We understand that funding environment for research, and we apply that knowledge to help frontline staff and the organisations we work with secure funding. Part of that is about building and maintaining multi-agency partnerships. When we take an idea and look at it and start to think about what project can we build here, how can we apply for funding for this, we look at it from a 360-degree perspective. So not just focusing on the organisation that has asked the question, help, we'd like to do this differently or better. We've got a problem. Can you help? What's the answer? We'll look at it very holistically. We provide ongoing end-to-end project management. And it's funny, actually, in the course of preparing for today, I've spoken to a lot of colleagues about project management, and people have different understandings of those two words. And what became very clear is that not everybody understands what we mean by project management. So people might think of project management of, I've got a project that I'm running and I'm responsible for my little bit of it. We do what I describe as, in very technical language, herding cats, which is that overarching strategic project management, bringing together a very disparate group of organisations and people quite often to ensure that everybody, although they want the same thing, they're pulling in the same direction the whole time, such that outcomes are met, targets are reached, deliverables achieved, and everything runs on time and on budget. Talking about budgets, we work with a range of funders, including the NIHR, Horizon Europe, the National Lottery, and foundations. Ultimately, we turn viable ideas into successful projects, and successful projects mean improved patient outcomes, fewer admissions, fewer delayed discharges, and a healthier overall population. So where do we fit in the scheme of health and well-being overall? You'll see on one side of this line, we've got ill health treatment, which the NHS providers do. And on the other side of it, we've got ill health prevention, which the NHS is asked to do, as is local government. but also society plays a huge part in that. The NHS cannot do both. Everybody's aware of the pressures that it is under, and it cannot have sole responsibility for community well-being. That has to be based in the community, and as such, a partnership and collaboration between statutory services, the third sector, private sector, and academia. We sit right bang in the middle of that. We're neither one nor the other. We act as a hub, providing an evidence base and solutions to support well-being and prevent ill health and help address health inequalities. What we don't do, and picking back up on my previous slide a little bit, is get involved in clinical research trials. We do work in collaboration with research teams across the NHS, but we are about healthy populations, community health and well-being, not testing the latest drugs and seeing the outcomes. Why do we do this? I'll leave you to look at the image on the side of this slide. The important things that I'd like you to focus on are the fact that when you look at a community and a person's well-being, only 20% of good health is considered to come from clinical interventions. 80% of that is associated with health-related behaviour, socioeconomic factors, and environmental factors. And apologies, Sedi, I know I have pinched this slide from you, but it does lead me very nicely to my next one, which shows what we do in far greater detail. So I wanted to try and make this a bit more real and take just some abstract images and numbers from the previous slide and unpack it a little bit better. And give you a real feel of how this is relevant to everybody. So at the centre of my slide, we have somebody who is in employment and should be a healthy, productive worker. In the first ring of images around that person, I've put some things which may contribute to whether that person is a healthy, productive worker or not. So, for example, have they got any underlying health conditions? Have they got good access to NHS services? Are they taking part in any unhealthy behaviours, smoking being the obvious one here? And have they had good access to education leading up to that point where they become an employee, and ongoing education to make sure that they are still trained and productive for their employer? But then when you take it one step further out of that ring, there's much more going on that actually will determine whether that person is healthy and productive. Starting at the top, the quality of their housing plays a huge part on their underlying health conditions. So, for example, are they living in a damp, mouldy house? We know that that has big impacts on respiratory diseases. Have they got access to green space? We know again that that plays a huge part in encouraging positive mental health and helping when people do find themselves at a slightly lower ebb. It also helps with air quality, which links back to those underlying health conditions. Can they take part in exercise that's appropriate and relevant and easily accessible? In terms of access, have they got good transport available to them? Not only excellent connections, but is it affordable? Finally, are they, moving on, are they supported by their family, friends and community? What are their personal relationships like? Because again, that plays a huge part in how healthy and well somebody is. What are their own personal economic circumstances? How does that impact on the fact of whether they can get a job? Can they actually get on the bus to get to a place of work? And what's their diet like? Have they got access to those famous 5 a day? Because again, we know that that also plays a big role in determining how healthy somebody is. So all of those things, when you look at them in that bigger picture, they're not the NHS's responsibility. They're everyone's responsibility, including the employer that's actually right at the centre of that diagram. Similarly, When we're looking at research and development projects, frontline staff need help in coordinating that bigger picture. And that's very much where we come in and what we do. And we've worked on most of these themes represented in this slide, plus a few others in the course of our existence. Just to give you a bit of a flavour of some of those, over the last 10 years in Kent and Medway, we've carried out a range of projects on a variety of very different topics. We have helped empower people with type 2 diabetes to manage their condition better, really putting them in the driving seat of their care and helping them manage their diabetes such that they're living with the condition, not having to adapt their lives continuously to the fact that they have got a condition. We've increased the quality of life of people living with dementia. And that's covered looking at the environments that they're living in. How can we really help support them to remember as much as they possibly can, to hold on to what they can, to feel calm, to feel confident, and to feel cared for in their local communities. We've done a lot of work around mental health. Firstly, looking at perinatal mental health, the mental health challenges faced by new parents when they become parents, and putting together a package of prepared parenting to support them in that journey. We've improved the sexual health of the over 45s. Quite often, public health interventions looking at sexual health tend to focus on the teenage years. However, we also know the older years are equally as important, and we've done a piece of work around that. We've helped support vulnerable people in their local communities so that they don't become what we have informally termed revolving door people, not quite fitting into one service or another, but moving from service to service in an attempt to find some help to support themselves. We've done that piece of work. We've transformed the way people receive community nursing care, empowering community nurses and the organisations they work for to be able to ultimately provide better care for their patients. We've tackled the thorny connection between obesity and unemployment. If you have, as an employer, two candidates who on paper who are exactly the same, yet when you see them at interview, one is obese and one isn't, chances are you are going to go for the non-obese person. Based on nothing else, we've helped tackle that stigma, we've helped break that connection. We've done a lot of work around mental health and well-being, recognising that suicide is #1 killer for men, and really working to try and tackle that, prevent it. And we've also helped support older people in their communities better, using technology to keep them safer at home for longer. So that is a little bit about us and what we have done. You can find out more at our website, which is here.